Hello, welcome back to Pharmacology Solution. Shall be discussing what are the sedatives and of course the CNS from the introduction to CNS pharmacology briefly, of course in a short presentation. Now, of course, we know that in the CNS, the neurons form the functional tissue or the functional brain tissue, and of course they communicate via neurotransmission at the synapses and with different neurotransmitters. Which are these neurotransmitters? Because the drugs which I'll talk about, they will be either acting on these receptors or mimicking these neurotransmitters. One is gamma aminobutyric acid, which is of course an inhibitory. The other one is the glycine, an inhibitory. Glutamate, excitatory. Now the others which we have either looked at or later on shall look at later on is acetylcholine, dopamine, 5-hydroxytryptamine, or the serotonin, norepinephrine. We also have the peptides such as those ones, the opioids, bradykinin, and all these ones. So most of the drugs in the CNS will be either be mimicking or inhibiting these neurotransmitters. Let us briefly talk about the sedatives or the anxiolytics and the hypnotic drugs. Now, of course, anxiolytics and sedatives are effective in elevating anxiety states and exert a calming effects. Now, of course, hypnotics produce drowsiness and encourage onset of sleep and maintenance of sleep. Those are hypnotics. Which are those examples of drugs? Which are those examples? Input examples. We have the benzodiazepines, barbiturates, which act via gamma A receptor at an allosteric site. We have melatonin. We of course we know that melatonin is mainly used when we are inducing sleep. The melatonin, if melatonin amounts increase at a time of sleep and they control the rhythm, the circadian rhythm, I'll explain later on. And of course, other drugs which are used to manage anxiety. Let us briefly look at benzodiazepines. They bind to GABA receptor, the GABA receptor at an allosteric site and enhance the GABA inhibitory effect. How? By increasing the duration of GABA-gated chloride channels, openings, and of course increasing entry of chloride ions, hence resulting in hyperpolarization. So now when you have hyperpolarization, there is no action potential. The examples we have xenophon, triazolam, medalazam, alprazolam, lorazepam, flurazepam, diazepam, clobazam. All these are the examples. Now, later on, they will have also short acting, long acting, and medium acting. But for me, I'm just talking about the examples. What are the therapeutic uses of benzodiazepines? Well, they are used in anxiety disorders, insomnia, status epilepticus. Now, of course, we know that when you have convulsion in malaria, we give diazepam. Also, they can be used as pre-anesthetic medication. Side effects of drowsiness, dizziness, lightheadedness, and depression. That's why it's not good for patients who have taken this medicine. Always encourage them to at least not operate heavy machine. And of course, chronic use can result in dependency or withdrawal symptoms. Remember, this is a short presentation. I'm sure you have more notes with you, or we can organize those trainings for you. Now, flumazenil, this is a competitive blocker of it competitive block benzodiazepine binding to the GABA receptor or the effects. Now this is an antagonist of benzodiazepine. Let's look at barbiturates. Of course, the mechanism is the same as that of benzodiazepine, just because for them they bind to the different receptor site. Examples include phenobarbital, secobarbital, thiopenta, methotrexate, all this one. There is in insomnia, management of status epilepticus, preoperative sedation, thiopenta, can use induction and maintenance of anesthesia. However, this one they produce strong sedation. These are strong sedatives, drowsiness, restlessness, and all those. Let us look at melatonin agonists. Of course, all of us know melatonin is important in our skin color. However, melatonin also regulates the biological rhythms such as sleep times, what you call the circadian rhythms, the sleep and wake cycle. Because during the time of sleep, the levels of melatonin increase in any area of the brain. Now, melatonin acts through melatonin receptor 1, which promotes onset of sleep, or melatonin receptor 2, which shifts the timing of sleep. The other drugs which are the melatonin analogs have lameltion and tosimeltion. Tosimeltion. Remember, this is a short presentation. You can always refer to the books, or you can contact us for more information. Now, other hypnotics which can be used are buspirone, etomidate, propofol, clomethazole, and of course the H1 receptor. These are of course we know, and I'm sure we are going to look at this one later on, especially when we reach anesthesia. We may talk about them. Now, these are the other presentation which have in CNS. You can always refer to them. These ones, I'm always remain Wilson from Pharmacology Solutions. Always contact us for more information through that WhatsApp number and email. Subscribe to the channel in case you haven't subscribed. Give us a comment on how maybe you can improve. Thank you very much.